Recently, Zilin, Quan, and others published a paper titled Effect of Banana Intake on Serum Potassium Level in Patients Undergoing Maintenance Hemodialysis, a randomized controlled trial, in the International Journal of Nursing Sciences. The fruit intake of patients undergoing maintenance hemodialysis is controversial. Limiting fruit intake can prevent hyperkalemia, but it may increase the risk of hypokalemia. On the contrary, appropriate fruit intake helps maintain potassium balance, yet it may increase serum potassium levels. This study aimed to clarify the effect of banana intake on the serum potassium levels of MHD patients. A single-center, randomized controlled trial was conducted. A total of 126 MHD patients were recruited and divided into an intervention group and a control group. Serum potassium and blood glucose levels were measured before hemodialysis, 2 hours and 4 hours during hemodialysis, and before the next hemodialysis session, and complications were recorded. The results showed that 122 patients completed the study. The serum potassium levels in the intervention group were higher than those in the control group at 2 hours and 4 hours of hemodialysis. However, the serum potassium levels of both groups decreased with the prolongation of hemodialysis time, and the serum potassium levels before the next hemodialysis were within the normal range, without hyperkalemia. The decrease in serum potassium level in the intervention group at 2 hours of hemodialysis was less than that in the control group. Meanwhile, the incidences of arrhythmia and hypokalemia in the intervention group were lower than those in the control group. There was no significant difference in blood glucose levels between the two groups, but the decrease in blood glucose levels in the intervention group was smaller at 2 hours and 4 hours of hemodialysis. This study indicates that consuming 250 g of bananas at the start of hemodialysis is safe. It neither causes post-dialysis hyperkalemia nor increases the risks of hypokalemia, hypoglycemia, and other complications. Moreover, it can effectively reduce the incidence of arrhythmia and has a positive effect on maintaining the stability of serum potassium and blood glucose levels in patients. Welcome to follow International Journal of Nursing Sciences, and welcome to read the latest articles and submit your papers.